Vital signs measurement. Vital signs are essential indicators of a patient's overall health and well-being. As a certified nursing assistant, it is crucial to accurately measure and record vital signs to assist the healthcare team in assessing a patient's condition. This section will provide an overview of the different vital signs and the proper techniques for measuring them. Temperature. Temperature is a vital sign that reflects the balance between heat production and heat loss in the body. It is measured using a thermometer and is recorded in degrees Fahrenheit or Celsius. The most common methods of measuring temperature include oral, axillary under the armpit, tympanic in the ear, and infrared or thermal on the forehead. To measure oral temperature, instruct the patient to place the thermometer under their tongue and close their mouth. Ensure that the thermometer remains in place for the recommended time, usually around 1 to 2 minutes. For axillary temperature, place the thermometer in the patient's armpit and hold their arm close to their body for accurate results. Tympanic and infrared thermometers provide quick and non-invasive measurements. To measure tympanic temperature, gently insert the thermometer probe into the patient's ear canal and press the button to obtain a reading. For an infrared temperature, point the thermometer at the patient's forehead or wrist, following the manufacturer's instructions. Pulse. Pulse rate measures the number of times the heart beats per minute and indicates the heart's efficiency in pumping blood throughout the body. The pulse can be felt in various locations, including the radial artery, wrist, carotid artery, neck, brachial artery, inner elbow, and femoral artery. To measure the pulse, place your index and middle fingers over the chosen artery and apply gentle pressure until you feel the pulsations. Count the number of beats for 60 seconds to obtain the pulse rate per minute. Ensure that you record the pulse rate accurately and note any irregularities or abnormalities. Respiration. Respiration refers to the process of inhaling and exhaling air. Respiratory rate measures the number of breaths a person takes per minute. It is essential to assess a patient's respiratory rate to monitor their breathing pattern and detect any abnormalities. To measure respiratory rate, observe the rise and fall of the patient's chest or abdomen for 1 minute. Note the depth, rhythm, and any signs of difficulty or distress during the assessment. Blood pressure. Blood pressure measures the force exerted by the blood against the walls of the arteries. It consists of 2 values: systolic pressure, the pressure when the heart contracts, and diastolic pressure, the pressure when the heart relaxes. Blood pressure is recorded in millimeters of mercury. To measure blood pressure, you will need a sphygmomanometer, blood pressure cuff, and a stethoscope. Wrap the cuff around the patient's upper arm, ensuring a snug fit. Inflate the cuff until you no longer hear any sounds through the stethoscope. Slowly release the pressure while listening for the first sound, systolic pressure, and the disappearance of sound, diastolic pressure. It is crucial to follow the correct technique and use the appropriate cuff size for accurate blood pressure measurements. Record the blood pressure values and note any significant changes or abnormalities. Pain assessment. Although pain is subjective and varies from person to person, it is an essential vital sign to assess and manage. As a CNA, you will play a crucial role in monitoring and reporting any changes in a patient's pain level. To assess pain, use a pain scale that the patient can understand and communicate effectively. The most common pain scale is the numerical rating scale, where the patient rates their pain on a scale from 0 to 10, with 0 being no pain and 10 being the worst pain imaginable. Additionally, observe the patient's facial expressions, body language, and verbal cues to gather more information about their pain experience. Document the patient's pain level and any interventions provided to alleviate their discomfort. Regularly reassess the patient's pain to ensure appropriate pain management. Documentation and communication. Accurate documentation and effective communication are vital aspects of measuring and recording vital signs. As a CNA, you will be responsible for documenting the vital signs accurately and reporting any significant changes to the healthcare team. When documenting vital signs, ensure that you record the values, the date and time of measurement, and any relevant observations or abnormalities. Use clear and concise language. avoiding abbreviations or jargon that may lead to misinterpretation. Communication is essential when reporting vital signs to the healthcare team. Provide a clear and concise handover, highlighting any significant changes or concerns. Remember to respect patient confidentiality and only share information with authorized individuals. By mastering the techniques for measuring vital signs and understanding their significance, you will contribute to the overall care and well-being of your patients as a CNA. Regular practice and ongoing education will enhance your skills in accurately assessing and documenting vital signs. Please